Hello, everyone. Welcome to the YODH Dialogue, a one of its kind podcast series featuring experts and stalwarts from the digital health space who have been paving the way for digitization and integrating technology in health. I am Rudraksh Rishi Mitra, your host for the day and a passionate member of the YODH community. YODH is a community of young digital health professionals that aims to empower the next generation of emerging thinkers and practitioners to drive the digital in health. If you want to become a member of our community, simply go to our website and sign up. We are always excited to join hands with professionals and young professionals from around the world who are invested in this sector. Today's guest is someone who wears a great many hats. He is a medical doctor, an academic, and perhaps most pertinently, an energetic thought leader in the digital health space. I am talking, of course, about Dr. Bilal Mateen. So, Dr. Bilal Mateen, thank you so much for joining us. Bilal is currently the executive director for Digital Square and focuses on digital transformation of health systems to achieve global health equity. He's a physician by training and a digital health technologist by profession. He has an academic interest in machine related applications of data science and machine learning and holds an honorary professorial appointment at the University College London. Bilal has also done a clinical data science fellowship at the Alan Turing Institute. And prior to his role at Digital Square, he served as the clinical tech lead and senior manager for digital technology at the Wellcome Trust, where his team worked on funding digital public goods to address key global health and sustainability challenges. So, welcome to the show, Bilal.
Thank you very much
Let's
for
get
having
right
me.
into it. Of course. So first and foremost, like already there, we can see that your career has been a fairly eclectic one across the realm of health, and there's been some very interesting transitions. Can you describe your journey for us a little bit? Going from being a physician to now this role where you're pioneering digital health technologies.
It's a very kind introduction, and I think eclectic, eccentric is definitely the right word for it. I actually applied to medical school knowing that I didn't want to be a doctor, and the arrogant 18-year-old that I was, I actually said it in my interview, and they were very kind and still let me in to spend 6 years studying medicine. But the reason I went down that path was because I think I was the last generation before you saw this slate of new bachelor's and master's courses that let people work in the space of health and well-being, but not necessarily as a practicing physician. You have lots of health data science masters and bachelor's courses now. You have a lot of health regulation and law courses now. I don't think they existed at my time, or at least I didn't know about them. And thus the path that I saw was go to medical school, understand the system that I wanted to impact, and then branch out. So very quickly at medical school, I started looking for other opportunities, and I ended up falling in with the academics. It was actually during my bachelor's, which was in computational neuroscience of all things, that I learned to code. It was my first introduction to machine learning as a concept. And I ended up building a tool to help my supervisor predict which of her patients was going to fall in the neurorehabilitation unit at Queen Square in London, which was a fascinating project. And I've become weirdly interested in the impact that falls can have, which is an interesting little tangent my life went on. But through that process, I realized the impact that building an effective evidence base that research can have in improving how we provide care, the whole idea behind evidence-based healthcare, which was, I think, pretty critical to the journey I was going on. Because soon after that, I started the fellowship at the Alan Turing Institute, which is the UK's National Institute for Data Science and AI. That was just a rapid exposure to lots of cool examples of how you can do this work at scale. So the first project I ended up working on was building a machine learning model for the government of Scotland to predict the likelihood that the likelihood of every person in Scotland being admitted to hospital in the next year. And these scores were generated on a monthly basis and sent to everyone's general practitioners so they could try and do preventative care. So we were working on some really rich data across all 6 million plus people. And it was incredible to have access to that wealth of information, which are the kinds of assets that you can't really get access to in most parts of the world, and is a testament to the infrastructure I think the UK has invested in over the last several years. In parallel, I was practicing medicine, slowly plodding along, realizing that treating one person at a time really wasn't doing it for me. The thing I was yearning for was a sense of scale. And so I managed to bring it all together with this super cool job at the Wellcome Trust. So I joined as the clinical tech lead, And then over the course of 3 years, had the opportunity to help build out their digital technology funding strategy, build my own team. I think at its peak, we were spending something like £100 million a year on all sorts of digital technology across mental health, climate health, infectious diseases, and discovery science. And then after 3 years of spending a lot of other people's money, I realized that I was going to have to wait 5-6 years to see the impact of the grants that we funded. And the thing I hadn't seen or hadn't had the experience to actually do was understand how these technologies get implemented in the rest of the world. Right? I trained in the UK. I did a lot of my academic research in the UK, but we're a tiny island on a large planet. And so I got this opportunity to come join Digital Square and see what it looks like to focus on digital transformation of health systems in low and middle income countries. And I couldn't say no. So I jumped ship about 6 months ago, and I've been slowly learning the ropes, but it's been incredibly fascinating, probably the steepest learning curve that I've been on for a while, but I've got a brilliant team, and we've done some really cool work, even in the last 6 months, if not the last 7 years that Digital Square's been around. And I'm looking forward to telling you a little about some of it.
Thank you so much for sharing your journey with us. I mean, as you were talking about it, I could see in your eyes that you were reflecting on your own journey in this, sort of bite-sized format. And I think what you mentioned there is, we all start off when we're kind of young, and I think the key aim for all of us is to be able to affect change at scale, but also be close to, be able to see the impact of what we're doing. And I think that really shines through your journey. And, we have to commend you for taking that step, even though it does entail a steep learning curve, as you did mention. But you did mention your work at Welcome First. And as you mentioned, you've been working on pertinent issues such as mental health, which is becoming quite the epidemic as we speak, as well as climate change and infectious diseases. Do you want to tell us a little bit about some of the digital technologies you funded there and the kinds of problems that they're hoping to address?
Yeah, I'd love to. So I'll give you one example from each of those 3 domains, and I'll try and pick some that illustrate, I think, a really critical point about the ecosystem and how I think we need to be thinking about the issues around the implementation of digital technology globally. Let's start with the mental health space. My team at Welcome made a grant to the MHRA, who are the UK's regulatory authority for medicines and medical devices in the UK. Critically, just to give you a bit of context, what we're seeing in the AI as a medical device space, which is a sector I'm really passionate about and which is where I spend a lot of my academic time thinking about, is that regulation is being built for tools and medical devices that really address physical health problems, because that's what the market's producing and thus what the regulators are getting a chance to react to. So if you look at the over 500 now AI as a medical device products that the FDA has approved, a lot of them are about stroke diagnosis on CT, or their cardiac heart pathology related diagnosis on cardiac MRI or ECG. It's a slate of physical health issues. And what we really neglected is mental health. And there's this nuance in mental health that many people may be familiar with, that a lot of tools fly under the radar as wellness apps. And it's quite hard to make the distinction between what's a wellness app and therefore outside of the scope of regulation and what's a medical device and what's in scope. Regulators have been reacting and focusing on physical devices. We haven't invested enough in answering these really nuanced questions that help create clarity for developers and the market as a whole to understand where they can push the envelope forward on developing the next slate of digital therapeutics and digital diagnostics for mental health. So what we did was we funded the MHRA, so they had the time, the space, the money to hire the experts to come up with a set of guidance around mental health software and AI as a medical device. And the real point that I want to drive home and why I chose this example is that it's about investing in the regulatory safeguards. It's not just about the technology, it's thinking about the entire enabling ecosystem that allows that technology to go from an idea in someone's mind to an alpha on someone's computer in some code, all the way to the bedside where it's actually helping someone. And all too often we invest heavily in the research and not enough in that translational pathway that actually gets it into people's hands so that it can have the impact that we all want it to. So that's the mental health example. Let me give you an infectious disease example. So my team funded the world's first randomized controlled trial of a climate-informed early warning system for dengue in Vietnam. It's called the e-dengue trial. It'll take 5 years to report out, but what's super cool is that we're going to cluster randomize every single district in the Mekong Delta, so all 134, in partnership with the Vietnamese Ministry of Health, And what the tool does is, instead of giving you a 2-week out forecast, it gives you a 2-month out forecast, which is now enough time that you can get all the medical countermeasures you need to prepare for a dengue outbreak. And what we really pushed for, what I think we need to push for more in the space as a whole, is that the primary outcome of the trial is the number of severe cases of dengue and dengue-related mortality. It's not how accurate the tool is, it's how many lives we've saved. And again, the point I want to make there is it's about building the evidence base, because we know the evidence base for the effectiveness of digital technology is profoundly lacking. And in truth, a lot of digital technology that we're investing in is only going to provide an incremental gain. But at scale, that incremental gain can be really powerful. And the World Bank actually just previewed a new cost model for the nerds out there, which shows that even small improvements at the 1 to 2% scale across an entire health system can actually result in cost recovery of several $1 million of investment in terms of the quality of life improvements that it brings for the population. So that's mental health, then infectious disease, and the last one very quickly, the climate and health space. And this one's incredibly close to my heart because I spent a year working on it. So it took up a lot of my life. But welcome, and we got to announce this at COP, which is the annual UN climate conference, which just happened in, I believe, Abu Dhabi.
I think it was Dubai.
It was Dubai. Sorry,
Yes.
one of the it was in Dubai. Yeah. We had a wonderful panel talking about the impact that digital public goods can have on helping us address the climate crisis, and it was an opportunity for Wellcome to announce that they've made $16 million of investment in DHIS2, which is the world's largest health information system. It's used in over 100 countries, over 60 low and middle income countries at national level. And the cool bit of the grant that I want to emphasize is there's 10 million over 5 years in there for just core maintenance and software development. That's everything from security, interoperability, analytical capability, transitioning to the cloud and back, and financial sustainability of the product. All critical things for digital public goods like DHIS2 to exist. And I really want to credit the leadership at Wellcome for being willing to leverage their philanthropic capital to make that kind of investment. The thing that we all hate to pay for, right? It's keeping the lights on rather than the new, innovative, sexy technological advancements that get press releases. So those are the three things that come to mind that I'm super proud of. And there was a huge team behind them all. So super grateful to all of them.
One thing I really enjoyed hearing, especially in the examples about mental health and infectious diseases, so is like your emphasis on bringing interventions, your emphasis on basically affecting the lives of people instead of just focusing on the technology and what, as you mentioned in the dengue example, which is, it's not about the accuracy of the diagnosis itself, it's about how many lives you can save. And I think that does get lost a little bit in translation, I think, when it comes to matters of developing tech for good, which is we focus a lot on the tech aspect, but we focus, we lose focus of exactly what the tech is supposed to be for. And I think that's where I enjoyed hearing, you were talking about enabling an entire ecosystem. And that's where I think every single component of an ecosystem is very important. It can't work in silos. And, that's something that really stuck out. Another thing that obviously sticks out from, the last example you gave, and obviously a lot of your work has been around digital public goods. And a large part of our community is, very young professionals like myself who are looking to make an impact within the realm of public health, who are looking to achieve impact at scale. And we just wanted you to talk us through, what you understand by digital public goods and how you've seen them being used to address, global public health challenges.
It's a great question. And I actually spent a lot of time trying to figure out what digital public goods were myself. I think there are maybe 100 at least definitions that are mostly consistent. But at its core, I think the way I describe it, the digital public good concept is really simple. It's open source software, it's open content and data, it's open models, it's open standards. Really, it's any digital asset that someone can freely access, use, modify, and share. That's what it is at its core. And at Digital Square, what we do is we talk about a subset of digital public goods called global goods. And the reason we do that is there are tens of thousands of DPGs out there right now, but only a few have really demonstrated true maturity. And what I mean by maturity is that A mature digital public good is one that's being supported by a strong community, has a clear governance structure, it's funded by multiple sources, it's been deployed at significant scale across multiple countries, and to that earlier point, it's really demonstrated the effectiveness in improving people's lives or delivering operational efficiency gains that we know is so critical. And we actually created a series of maturity models to help the community figure out how far they are away from their DPG being eligible to become a global good. And we run a certification process. We just added 6 content global goods. So we got 42 in total. And we, a few years ago, plotted a map of where all of these global goods are being used. And it's, I think, really interesting that, if you believe it or not, every country in the world uses at least one of these global goods. And too often when we say global health, what we mean is the health and well-being of low and middle income countries. And this time, what I really want people to understand is that when we say that there are digital public goods being used to address global health, we really do mean global, especially when you look at these mature DPGs.
Well, I mean, you've mentioned global goods, and I want to know what's one of your favorite, or the pick of global goods that you can think of, an example that you can give us, that so that we can understand it better.
So instead of telling you about a project we've done, let me instead share what I'm excited about. So to date, we've been focusing really narrowly on health, which was an intentional decision because it's a really large canvas to work on. But the world is changing. We're facing a new existential threat, climate change, which has really profound implications for our health and well-being in the near and the long term. And what I'm excited about is finding ways to branch out from our singular focus on health to thinking about that intersectionality of climate and health going forward. And that's one of the ways in which we're going to experiment with this platform and community we've created. The others are around novel business models, blended financing, and public and private partnerships as pathways to sustainability. But yeah, I'm so tempted to name the few that immediately come to mind as stellar examples. But instead, I'm just going to point all of our listeners to go and check out the Global Goods website, and then they can decide which one they're most impressed by. And I won't have admitted which one is my favorite.
Well, fair enough. We'll apply our own interpretation to it. You did mention the private sector there. And when we talk about the health industry, would you agree that there has been a surge in private sector engagement in digital public goods? And how can we sustain this kind of interest over time? Because, we do need the private, public, and nonprofit sector to all work together. And now we are seeing, it seems that we're seeing a little more investment from the private sector, which could be key, I think, to making sure these initiatives come to fruition.
Yeah, I think you've hit the nail on the head. There's definitely been a surge in private sector interest in DPGs. And it's helpful for me, at least, to separate that out into a few buckets. So it's the builders, the implementers, and the healthcare service providers. So first, with the builders, we're seeing a huge surge in interest from large technology vendors. And critically, we're beginning to see them engage in developing DPGs themselves. The best known example is probably Google's Open Health Stack, which includes the Android Fire software development kit. And that last bit, again, for the nerds out there, is usually shortened to SDK. So you'll hear me refer to the Android Fire SDK a lot, which, to your earlier point, and I'm not admitting it's my favorite, is one of Digital Square's global goods. And for those of you that aren't familiar with what an SDK does, it's a library of tools that allows you to build an interoperable, in this case, Fire-compliant Android application. In fact, our team in Kenya is actually working with Google to use the Open Health Stack to create some software to support the national immunization program that's called Chanjo KE. And the path to sustained investment and interest here, it's self-interest, right? Which is fine. Businesses require sustainable revenue streams. And at least my interpretation of Google's strategy is that they're trying to build tools like the Android Fire SDK to lower the barriers for a software developer like you, me, or someone else to build an application within the Android operating system. And what that does is it creates a bigger and better value proposition for consumers like us when we're deciding what phone we want to buy. And then I become the next pair of eyes that they can sell to advertisers. So the challenge here, when I think through that business model, is there are really few companies with the scale and the differentiation like Google, that kind of upside, the upside of that kind of approach to even be measurable. So the challenge for us at Digital Square is leaning into our role as a market shaping entity to research and conceive different business models for smaller players and trialing them to demonstrate proof of concept so that we can build interest from the SMEs in the private sector to engage more as the builders of the next generation of DPGs. Now, that second group, the implementers, they've been engaged, private sector implementers have been engaged with the DPG ecosystem for a lot longer. And we've seen a thriving marketplace of local software service entrepreneurs pop up. There's a whole slate of them in India, where you're based, and in several parts of Africa as well. We do a lot of work with teams like Gembi in South Africa, Intellisoft in Kenya. The example I'm thinking of from India is Argosoft. Right, I'm really excited about finding ways to drive further investment to these groups because they're the anchors of our localization strategy. And we recently closed out an interesting project called DHE, the Digital Health Ecosystem Project, which again is worth reading about if folks have got time. There's a lot of information about it on the PATH website, but we were doing a series of capacity strengthening exercises with local entrepreneurs to see if we could help them figure out, again, new innovative business models for them to engage with the open source software ecosystem in the digital health space. And then the last one, just because I've been reflecting a lot on the progress India has made, is private healthcare service providers, right? We've had loads of, private sector providers exist pretty much everywhere. But I think we're at an inflection point, and this is purely anecdotal. But at least in my experience, we're seeing providers understand the value of procuring software that complies with open interoperability standards, which are also DPGs. And to your point about sustaining interest, I think it comes down to helping people understand why it's in their best interest. And the most compelling argument I've seen is they're able to exchange information with the wider healthcare ecosystem so that they can provide better care to their patients. But the reason I reference India is because with the ABDM, you're seeing governments start to take this really seriously, which creates a whole new set of reasons for the private sector to care.
You did mention, like in your first point, about driving investment into the sector and you mentioned Google as a big player, and you did mention that a key part of your job at the Digital Square might be engaging smaller players, maybe even SMEs. Can you tell us a bit about what incentives for them might look like in the coming this? That's something that immediately piqued my interest.
The key way that we're thinking about the value proposition to SMEs is this pathway to scale. In a lot of countries in which we work, the global goods that we're talking about have been adopted by government to create the backbone of their digital health infrastructure. And in doing so, you have this platform that is servicing millions, if not tens of millions of people already. The value for an SME going in is if they can help the government build that next application, that next service tool, they are immediately servicing the needs of tens of millions. And the opportunity here is much larger, despite the fact that the work is pretty much the same. When you're building the extension to something like Medic's Community Health Toolkit or the Comcare platform that Dimagi runs, it's the same software developers that can do the work, assuming you have those core competencies, but it's that access to scale. Because if you did that for a company in India that has 1,000 employees, the size of that contract is fundamentally different than when you're doing it for government that's trying to service its entire population. And so that's what we were trying to do in the Digital Health Ecosystem Project. It's taking companies that have the core competencies to do software development and helping them see the opportunity to do that, to support the maintenance and extensions to the digital health infrastructure that governments have invested in.
Okay, that was a fascinating answer, and thank you so much for elaborating on that. Now I want to take you to a completely different dimension of digital health and the like. We spoke about driving investments into digital health. Now I'd love to hear you talk about how you see public healthcare becoming more equitably and ethically accessible by last mile users, so the beneficiaries themselves. What are the biggest obstacles that we need to address, and what do you think can be done to overcome these challenges when it comes to making sure that public healthcare infrastructure and these digital public goods are actually of viable use for the last mile users, the end users?
I thought a lot about this when you warned me that this might be a question that I got asked. And I tried to come up with a snappy way of summarizing it. I think it comes down to connectivity, capacity, and communication. Right? Let's start with connectivity. Whilst we're here funded by an initiative that wants to put youth in the driving seat of digital health, right? It's important to remember that one of the key resources that those young people need is access to the internet. And for a lot of young people, access to mobile data is prohibitively expensive. It's one of the reasons that young people were called out as a critically underserved community in several recent digital ecosystem assessments that we've done and our partners have done across Africa and Asia. right? And I imagine much is the same is true for other countries that we didn't do those assessments for. But until we can address that connectivity gap at the last mile and other underserved communities, we're probably going to see growth of certain health inequities, right? We're going to actually see them accelerate as urban dwelling, middle income communities in developing nations benefit from digital technology enabled access to healthcare faster than the rest. That first point of a major obstacle that we need to address is going to be connectivity, both grid access to electricity and also the internet access I just talked about. The second one around capacity, right? If we're honest with ourselves, a lot of what we've done in the digital health community over the last couple of decades isn't really digital transformation, it's a digitization. What we've done is we've put tablets into the hands of community health workers that service some of the most rural and remote communities, but we've done that to increase the speed at which they collect the information. We've done it for ourselves so that we can get that information in a structured way, so it's easier for us to analyze. But have we really invested in those community health workers so that they become a meaningful part of the process? I'd argue in a lot of cases we haven't. So let me use one specific example of where I think that's critical for ethical applications and deployment of digital technology at the last mile. I don't know of a single community health worker program that explicitly invests in digital literacy as a core part of the training. If anyone listening does, please reach out, let me know. We're so excited about trying to find one because none of them invest in it, as far as we know, despite the fact that those community health workers are handling really sensitive personal information, which in most countries has a long list of compliance requirements, many of which those community health workers are actually responsible. And for us to be working ethically, I think a great place for us to start is to make sure we're meeting the regulatory thresholds around data protection, because you can be certain that a hospital servicing a high-income community has invested to figure it out. And I think that the expectation should be exactly the same at the last mile. And so it's on us. The implementers, the international NGOs who work with these community health workers, who support governments to set up these programs, to make sure that we're putting that at the top of the agenda. And then finally, it's that communication piece. And by communication, what I really mean is community engagement. I was listening to a colleague when we had our global leadership retreat at the end of last year tell this story. So I'm going to completely plagiarize it and steal it from her, which was she was running a malaria bednet campaign, I believe in Zambia. And they saw that there were certain pockets of the community that weren't experiencing the impact from the campaign that they'd expected. And so what they did was they sent out some folks to just go and speak to members of the household to understand what was going on. And the story she told was of one of those researchers arriving at this house, meeting a mother with her young children, and asking her if she'd received the bed nets. The mother went, yes, absolutely. And she went, oh, can you show me? And the mother walks the public health worker over to a cupboard, opens it up, and on the top shelf there are 4 bed nets. And the public health worker goes, you do know that you're meant to put it around your bed, and that's how it stops the mosquitoes biting you. And she went, yeah, no, they explained that, don't worry. And she went, so why aren't you using it? And they went, because when the public health worker came to the house to explain to me, they said that it killed all the mosquitoes, 100% of them. And the public health worker looked at her just in sheer confusion and went, so what's the problem? She went, I have a young baby. What if it puts it in its mouth? If it kills 100% of the mosquitoes, what's it going to do to my baby? And suddenly the public health worker realized, oh, we'd failed to explain that the baby wasn't at risk. The aspect of if you're not actively thinking about your last mile users as you're building a solution, you're planning a rollout, you shouldn't be surprised when you fail to realize the impact you thought you would have. I think we often forget about the importance of user-centered design and engaging our target community. And it sounds simple, and yet we both know of programs that have missed really obvious insights that a 10-minute conversation with someone from the community would have surfaced. So connectivity, communication, capacity strengthening, I think are the critical things we need to address for us to really see that impact in the last mile that we want.
I really enjoyed your example on the communication aspect, because I think it's extremely applicable to the context that I'm in here in India. I remember we were trying to do a project on natal care, and we wanted to talk about gestational diabetes. And obviously, given that India, in rural India, a lot of the places, especially in like the eastern parts of the country, the diets are very heavy on carbohydrates. So a lot of rice is being consumed, and the ethos over there, because I went to a village which is basically in the middle of a tiger habitat, So it's surrounded by jungles. And obviously, in theory, like our policy in India says that there is a primary healthcare center within 5 kilometers of every single village or settlement.
Yeah.
But 5 kilometers in an urban area or even a semi-rural area is very different to 5 kilometers in the middle of a jungle that is full of dangerous predators. And over there, you know, even though there are community health workers that come and they have a certain degree of influence, generally people will skip that and they'll go by what we might call um, you know the knowledge passed down in the villages. So the midwife of the village, I think in India they're called the tai. That's what they were called there, and their principles were very simple. If you want to have a healthy kid, you need to eat as much as you can, and you need to eat as much of rice and potatoes and stuff like that as you can. And that is actually quite dangerous for a child if the mother has gestation, if she is if her glucose levels are rising during that the her pregnancy phase. But people are very reluctant any pushback from community workers, and that's where the communication gap shows up. People just don't trust. You can't just tell people. There has to be like seamless communication, and then people who are implementing health programs also need to understand how people on the ground think. You can't just come up with an intervention and expect them to take it on, because there's a lot of thought patterns, a lot of barriers and so forth. So I really enjoyed your example, and really appreciate you sharing your journey with us. um, I think that was all from our end. So to conclude this, we have some rapid fire questions that we hope you'll oblige us with. So shall we get into it?
Please go on.
All right. So the first one we have is, what's one technology that you can't live without?
My MacBook Pro.
Fair enough. I think I would have to agree with that one. One word to describe digital health's future.
Dynamic.
Your role model in digital health.
Professor Randy Pausch. If you haven't seen the last lecture, I would pause this podcast and go and watch it. It's on YouTube. Best 90 minutes that you'll invest in today.
That is a great story. I think we read it in school. It was part of my
Very
text in
good.
school, yes. And then I read the whole thing later. That was a good one. The first task you did when you joined the Digital Square.
I put aside the laptop that I had been issued and figured out how to set up my MacBook as my work laptop.
Fair enough. Would you call yourself a book nerd or a tech geek?
Book nerd, but to be more specific, research nerd. You're more likely to find me on my phone scrolling through the pages of an academic manuscript than you are a hardback book, unless it's a textbook.
Well, we were going to ask you what book is in your nightstand right now, but I think we may have to change that to what research paper is currently on your phone.
It's actually a paper about large language models in primary healthcare setting. The Google team released it last week. And in the paper, they introduced a new tool called AMI, Articulate Medical Intelligence Explorer. It's a large language model-based system that's optimized for diagnostic dialogue. And they show quite elegantly how the system's performance compares to that of primary healthcare physicians from India, Canada, and the UK in this cool randomized crossover study. And not only was the large language model more accurate more often according to specialist physicians, but also to lay reviewers. They thought that it was both more accurate and more empathetic, which I thought was interesting. And so the paper basically shows the potential for autonomous applications for large language models for diagnosis of ailments in primary healthcare settings. I think for the first time.
Well, that sounds pretty fascinating. I think we should all go and give it a read. And finally, what's one tech skill everyone in this sector should have?
The ability to Google effectively. What I love is that the advent of large language models has mainstreamed the concept of prompt engineering and how it's one of the most effective ways to get or improve the quality of an LLM's outputs. Hopefully everyone listening will intuitively understand why I think it's such an important skill. But if you're anything like me and you believe there's nothing new under the sun and everything you need is available online, then what ends up differentiating people is those who can find it and those who can't. So knowing how to Google and prompt engineer it, I think, is going to be one of the most critical skills going forward if it hasn't been for the last decade.
Oh, fair enough. So thank you so much for your time, Bilal. I think this chat was full of insights. I think there's a lot for me to think about as well, and I hope there's been a lot for our listeners to think about as well at the end of this. I hope this was the first of many conversations that we get to have. And a big thank you to you for your time and being so generous with your time and your insights with us. And hopefully, this will help all our budding YODH members, take their journeys in digital health forward, and hopefully also contribute to scaling the kinds of interventions and technologies that we need to see to achieve positive health outcomes across the globe. We'll see all our viewers soon for another very stimulating conversation, and please stay tuned to the YODH dialogue.